Hey Maggie, see you're here. Think your day has been nice and well. I've seen you on your lives, and today we are dealing with cerebrovascular accidents, issues concerning stroke, issues concerning transient ischemic attack, all accidents that are cerebrovascular. We are dealing with things that can affect your brain, and your brain becomes functionless. Cerebrovascular accidents. We'll see how this effect affects every. Yes. Hello. Okay. Now we will deal on specific things that are very important. People that get stroke, people without knowing, people that get headaches without knowing. Sometimes you get headaches that are not stopping, continuous headaches. Sometimes you get dizziness without knowing. So we can define. We start by, today we have someone with some veins in the head, some veins in the head. So as we continue now, we want to understand what is cerebrovascular complications. Cerebrovascular complication is the brain and the vessels that feed blood to the brain, the vessels that feed blood to the vein. You see, there are so many small veins around here that come and cover your brain. And when they cover your brain, there is a particular phenomenon. Mercy, welcome to the platform. Today we are covering several issues that make you have a stroke and make you have persistent headaches and several things that affect your brain. So when I'm saying uh, cerebrovascular accidents, I'm meaning the brain itself, because it is part of the vascular. It is part of the heart, the continuation of blood vessels. You can see. So there is some phenomenon called the circle of Willis in your brain. How your blood gets to your brain and then it covers all your brain round. So the circle of Willis is this thing that you're seeing here. You see, there are some veins that come from down and then they connect, they connect, and then they form a circle around your brain. They form a circle around your brain. It is a very important phenomenon and we will learn as we are going on. Now, whatever you are seeing is just some arteries that feed oxygen in your brain. So let's take up the ship and let's go on. Yes, Majay is here. Majay B, welcome to the platform. And Majay, I think Majay, you inbox me on WhatsApp. We talk. The brain requires constant supply of oxygen and glucose. It requires constant supply of oxygen and glucose. It's very important because your brain does a lot of work. Your brain does a lot of work when you are thinking, when you are sleeping, when you are walking. I've always asked something: when you are working physically, carrying cartons, or you have gone to cultivate in the land, and then you come back home in the evening after you've eaten and you relax, you feel like doing something else. But when you are stressed up and you are thinking a lot and you are thinking beyond something is really making you think. You will have a very hard time. You will feel the body is so tired because the brain uses a lot of calories when you are thinking. So you see, the brain requires constant supply of oxygen and glucose. Your brain. Any interruption of this, ischemia, or you see, cute JC, hi. You're the one who was asking about headaches. Now, today you will learn why headaches come, and why sometimes you feel headaches. Now, any interruptions will lead to oxygen deprivation. Any interruption to this arteries that you are seeing will lead to oxygen depreciation, Or sometimes when you have a problem with high blood pressure and one of these veins rupture, that is when you feel they say that you have internal bleeding. You have bleeding from the brain. So when you hear any person saying that hi, Judy, welcome to the platform, welcome to the platform. I'm doing this so that we clear issues concerning cerebrovascular complications, and then we will start treatment. The treatment of these complications are several. So one of this brain, when it ruptures, because maybe of high BP or something else, it's when that we get cerebrovascular injury. Now let's go. We see types of cerebrovascular injuries. What are the types? What are the types of injuries that you can get from your brain? There are several types of injuries that you can get from your brain, and it is very important to know them. One is, I like talking while I'm writing. Today, let me just sit and talk and discuss. One, we have the first one that we have is called, and I usually say, if you have a question, don't keep it. Just talk to me, ask, post it on the group we discuss. Now, on the chat. Now, ischemic stroke. Ischemic, we have types of stroke. So we have ischemic stroke. When you hear about ischemic stroke, what comes to your brains? When you hear about ischemic stroke, this one says there is no adequate supply of oxygen in your brain. No adequate supply of oxygen in your brain. That is ischemia. Your brain is lacking some oxygen. So what are some of the things that can make your brain to lack some oxygen? Welcome everyone to the platform. Say hi and you like, and we continue. Now, some of the things that can make you lack oxygen are like thrombosis, embolism, and atherosclerosis. You see, clot forming on, let's say, if a clot forms on this vein here, the blood that is supposed to be going on this side, it will not go because there is a clot that is not, it's making the vein not to have insufficient blood at the other end. So we call it thrombosis. A clot is thrombosis, thrombosis, like a clot. A clot, what it does, it blocks blood from going to the other side. And then we have embolism. Embolism. What is an emboli? I've always talked about clot travels from the heart and then it causes something atrial fibrillations. So when the clot travels to the heart, you get fibrillations, the heart beating irregularly. We have just talked about fibrillations. Yes, Barbara, Margaret, my sister is here, Zinkigre, all of you, you are welcome. And as we go on, please always do what? Post your question wherever, anytime. Any question so that we can discuss. Atherosclerosis. Atherosclerosis. Atherosclerosis, because you have always wanted to take fatty foods, and then they collude in your veins, and then when they collude in your veins, what happens is the next, you are having veins that cannot constrict well or relax well. They are tough veins. They are those things that do inside, that do these walls, these veins to be hard. They are called fatty plates. When fats are accumulated in these veins becomes hard to constrict and relax. So we call it fatty plates. Fatty plates. No, they cause atherosclerosis. Atherosclerosis. But embolism is a clot that travels from the heart when you're having fibrillations, and then it blocks them. It blocks the blood, these arteries, in this artery. So the other end, it loses enough oxygen. The thrombosis, we've talked about it. Now, this is how it happens. When vessels are occluded, the vessels are having thrombosis, embolism, they reduce blood flow to the brain. You see, they can even occlude from down here. They reduce blood flow to this brain. So when they reduce blood flow to the brain, you lose oxygen, and then you there is no something called ATP production. And you know, ATP is the form of energy that mitochondria, you remember mitochondria in biology, mitochondria uses ATP production, eh? And then when it loses that, you have failure of sodium potassium pump. The 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 cell, your cell, let's say on the cell wall, there is something called action potential. So let's say if here is negative, this side is positive. This is positive. The actual potential of this cell cannot happen when you don't have oxygen, because sometimes you'll find that this oxygen needs to go inside so that it gets polarized. You remember about our talk of this heart. We put it like this. The talk about this heart on polarization of the heart muscles, where the positive ions like sodium go inside the cell so that the atrium can contract. And when the atrium contracts, it pushes blood. So when you have no oxygen, this actual potential cannot happen. So you become uh, like a paralyzed person. Remember, we are talking about the brain. The brain. It has a way where it balances your oxygen levels and the blood that is supplied. So when oxygen is deprived, that is where you start feeling dizziness. Hmm? That is where you start feeling dizziness now. Yeah? And then it increases intracellular calcium. Hmm? Intracellular calcium. And you know, when you increase calcium in cells, much as in this valve, in this are blood capillaries, whatever you are seeing, this the drawing that you are seeing, these are blood capillaries. This is like, this one is called the common carotid artery, which brings blood. The common carotid artery, the common carotid, this one is the common carotid artery. But where does it come from? It comes from the outer of the heart. You see, it is here, the common carotid artery. Let me push this here so that you can see it. So from the outer of your heart here, it rises from here. So it takes oxygenated blood from the outer of the left side of the heart, and then it comes, and so these two are the common carotid artery. You get it? So when they supply blood on your on your brain, in your brain, so that your brain can get some. Evelyn is here. Welcome, Evelyn. It's been time now. From the We learned about the heart, and the picture of the heart is here. So the common carotid artery is this one, left and right common carotid artery, left and right. So they come and form. There's two. You see, there are two, and there are this one, left and right common carotid artery. They just came from the heart, and then they are supplying the brain. You see, they deviate here to form two things. They form, this one is called carotid arteries, left and right. And then we have the basilar arteries that are here. Those ones do not come from the common carotid artery. So we are saying that when you get calcium ion inside walls, walls of the carotid are made of cells. They are made of cells. Your your arteries are made of cells. Your arteries are made of cells. So they are like this. Some good cells forming a long that is attached like this. So when in these cells of the walls of these arteries, the cells of these arteries that are supplying your brain, with, they are, let me draw them here so that you can see like this. So when these cells, these small cells on the walls of the arteries get calcium inside, when they get calcium inside, what happens? They constrict because intracellular calcium, I'm meaning calcium that goes inside the cell, it causes this vessel to constrict. And when it constricts, when it becomes thinner, when I say constrict, you put your mind in becoming thinner. When they become thinner, there is not enough blood that is circulating here. They need to relax. And to relax, you have to stop. You have to stop what? You have to stop calcium getting into the cell. You have to stop calcium. That's why some people who are hypertensive, people who are under blood pressure, we give them some drugs called calcium channel blockers so that the calcium channel blockers can block calcium to go intracellularly so that these veins can remain relaxed. You get it? So when the enzyme increase intracellular calcium levels, what happens? Release of something called glutamate. Glutamate comes out. This is something called exocytosis. And when exocytosis happens, what happens is free radical formations. And you know, free radical formations, I've always talked about them. These are the causes of cancer and necrotic tissues. Necrotic tissues are tissues that are dead. So free radicals kill the vessels. When they are released after intracellular influx, there is no enough blood flow. What is released is free radicals. And then you get neural death. You start getting some places in your brain that are dead. You get it? If you have not got up to them, please just ask how people get brain death. You see, these are some things that happen uh, in you. We started by thrombosis, embolism, and then sclerosis. Something, maybe a clot happened to your, and what are the causes of someone may ask, what are the causes of clot formation? Hmm? What are the causes? If you know one, tell me. I know people know many myths. What are the myths that people talk about clothes, about what? You know all this. Tell me one that you know. If you know all the myths that people talk about, causes of clot formation. Hmm? Some people say if you use for ladies, this is for ladies. If you use what is this called? If you use family planning, you'll get clothes. Is that true? Hmm? Is that true? Someone told me that one day. If you use family planning, you can get clothes. But let's see what are the causes of clot formation. Clot formation can be caused by trauma. maybe when you get an accident, does high cholesterol cause clot? Yeah, clot, MAJB, understand a clot is blood that is clotted. Cholesterol forms a thrombi. We will see how cholesterol can form a thrombi. Now differentiate between a clot and cholesterol or fat. These are two things, a clot or cholesterol. So we check this out and we see when the inner lining of a vessel damage, when the inner lining of a vessel damages, yeah, clotting is triggered around, maybe you have trauma, maybe you've got an accident, and then let's see, this is the carotid, and then this inner, something has ruptured and you are bleeding, and you are bleeding. Clotting is triggered. So at the area where the vessel is ruptured, you will start having clotting factors. Hmm? Clotting factors at the area are like prothrombin, vitamin K, you see, Christmas factor. There are several factors that make the platelets that makes your blood to clot when they are exposed to the air. Because when they are exposed, the clotting factors come automatically. Hmm? So you might find it clots until it goes and have a very big clot that goes into the bloodstream and blocks the blood to flow. That is when maybe you've gotten an accident. And then we have atherosclerosis, plaque rupture, plaque rupture, atherosclerosis. This is a thing that people suffer from so much as atherosclerosis. It is a thing that people suffer from. You can get like the topic that we've just been talking about, the topic that we have gone through about rheumatism. A bacteria can rupture. A bacteria can rupture from the valves, and then the colony plus the dirt that are occluded, they go and close. You see, we said most of the problems start from the left ventricle. So here at the mitral valve, bacteria live here, and as they grow, they form a big colony plus some dirt and some cholesterol, and it can rupture and go to the bloodstream, and it can block the bloodstream. You see, it can block the bloodstream. So we that is one of the examples of atherosclerosis. Atherosclerosis means is a chronic inflammation of arteries where fatty deposits, the one that Marjay is asking. Now, Marjay, listen to this carefully. This is yours. Fatty deposits build up in the vessel walls. You see, the fatty, they build up in the vessel walls. Fats, when you take a lot of fats, they build up in the vessel walls. You see, and they block the vessel. They reduce the size of the vessel. Yeah, and at times when they grow, they block, it can cut itself and then it goes at the junction like here, and it blocks blood supply to the other end. Yeah, and it starts by several forms. You know atherosclerosis. Let me talk about it a bit. Let me talk about atherosclerosis a bit. Atherosclerosis starts by endothelial injury dysfunction. When your vessels have an injury, and we have said you can get an accident and you cut your artery, you can get a road accident, you can have at home an accident while you are working, and endothelial injury happens. And causes are like trauma, hypertension. When people have, we have learned about arterial fibrillations, high blood pressure or tachycardia, the heart beating so fast, smoking, diabetes, high low density lipoprotein, those are cholesterols. The endothelial become permeable and sticky, permeable and sticky, the one I've explained. And then I'm talking about now atherosclerosis, how they block this veins. You get it? Lipid accumulation. Now, the cholesterol pile up and pile up. Eh? And then when cholesterol pile up, you remember about the cells, the macrophages. They come to eat the problem, the what cholesterol that have piled, because they are saying this one is not. This is a stranger, it should be removed. So many macrophages cells come there to remove it. But as they are continuing to remove, they ingest the cholesterols. It is called low density lipoprotein. It's the most that affects people. They form cells, other cells, and then the other cells, they form something called fatty streaks. Hmm? Fatty streaks on inside the blood vessels, eh? And then fibrous plaque formation, because now, because the cells have come, they're trying to remove, you get that this place becomes, the vessels become so hard, the vessels become so hard, even relaxing and contracting becomes a problem. So that is what we call atherosclerosis. And the most common cause of atherosclerosis is hypertension. Hmm? You see, now when we continue about our topic of clot formation, we have said atherosclerosis, we have said hypertension can be a cause, infections and smoking can be a cause of it. So, uh, we have said how the blood formation flows and how the fatty streaks form and they block the vessel. So, you can have another form. That one was stroke. When I've said ischemic stroke, I'm saying stroke brought by lack of oxygen to reach where it is supposed to reach, or blood reaching where it is supposed to reach. But we have another one which is called hemorrhagic stroke. Hemorrhagic stroke. Hemorrhagic stroke is whereby bleeding into or around the brain. There are two types. Hemorrhagic stroke are two types. Intracerebral, inside the brain itself, or subarachnoid. Subarachnoid is between the brain meninges. Between, the brain is separated. So you get it bleeding between the brain meninges. You see, it is called subarachnoid. And the cause mostly is hypertension, aneurysm rupture, arteriovenous malformation, or trauma. Now, El Marie, hey, welcome to the platform. We are talking about causes of stroke or cerebrovascular accidents. Causes of stroke or cerebrovascular accident. So, we have said that hypertension, when the heart is beating so fast and hard, and your blood pressure is high, above 140 over 90, 140 over 90, what happens? This is what happens. This is what happens. These vessels rupture, and it depends on where the vessel has ruptured from. It can rupture here near the cerebral subarachnoid, between the space, or it can rupture here where it is as an internal. You get it? So when your BP is so high, you get a rupture and then you start bleeding. Or an aneurysm. Aneurysm means an artery that, let's take this artery that has come like this, and then it has formed a ball and then continued. So when your artery has an aneurysm, this aneurysm can burst and they can start doing what? They can start, it can burst and it can start doing what? You can start bleeding inside there. Because if you take this and you have an aneurysm, an aneurysm is an enlarged part of an artery. You will start bleeding, yeah? Or arteriovenous malformation. You get that these veins, another cause is these veins where they're having funny formation, and when you are having a high blood pressure, they start bleeding. Or trauma is whereby you get an accident, one of the vessels is hit hard, and then you start bleeding. Rogers, hello brother, welcome to the platform. I can see you are here. We are talking about causes of stroke or cerebrovascular vascular accidents or cerebrovascular accidents. Now, how does it happen? Blood leaks, intracranial pressure rises, compression of the brain tissues, toxic effects of blood breakdown products. Now, there is something called intracranial pressure. Hmm? Hmm? Who knows what is intracranial pressure? Intracranial pressure, let me say like this. You see, the way these arteries are, they are closed toughly through the spinal cord that goes down, up to down. And inside there is a fluid that is called cerebrospinal fluid. So between this, let me put like this one here. Let me put this here. So what I will say is this. I want you to watch closely. Um, Inside here, there is a fluid called cerebrospinal fluid, CSF. CSF. And why is it called CSF? Why is this fluid called CSF? Because it cushions the brain from injury, and it drops down to the spinal cord and cushions the nerve so that they cannot get injured. Hmm? Welcome, Rogers. Welcome, Rogers. So when it cushions the brain, and then it has a pressure that it is needed to be, so that it cannot compress the brain. But now you've got a problem. And when you've got a problem and you are injured, what happens? One of these arteries starts to bleed inside the head. It is increasing the amount of fluid. And remember, the blood is not cerebrospinal fluid. Cerebrospinal fluid is a protein that is very clean and clear. It doesn't have any toxin. Get it? It doesn't have any toxin. So when you bleed and then you start pouring the blood into the fluid that is going, what you are doing is you are raising the cerebrospinal fluid pressure because you are adding more blood to CSF, to the cerebrospinal fluid. One thing we'll start having is headaches, severe headaches. You have seen people that have meningitis, how they get headaches, meningitis. You will start having severe headaches and you will start having blurred vision. You are not seeing well because when the brain is compressed, and yesterday night we talked about cranial nerves. It means you are compressing the cranial nerves. So, like the one that is olfactory for the nose, even sometimes feeling the sense of the first cranial nerve, which is of fractal. Sense of smell you will not. Optic, because it is compressed with the blood that is adding to the cerebrospinal fluid and adding the pressure up. You will not see well. You remember? Olfactory, optic, oculomotor, trochlear, trigeminal, eh? Abducens, facial, hmm? facial, and then we have glossopharyngeal, and then we have vestibulocochlear, and then the vagus nerve. Hmm? You remember those, all those nerves are the cranial nerves, and when they are pushed, when there is an accident and then you start bleeding, what makes people not to see well is because now you are increasing the pressure inside the brain, and the brain is being compressed. And as it is compressed, it is pressing on the nerves that are helping you see accessory, hmm? accessory nerves that are even movement becomes a problem. That is called hemorrhagic stroke. You see, so hypertension, aneurysm occurrence, and arteriovenous malformation, we have said, are the causes of bleeding from the brain. Without, let's say, without accident, maybe you can get an aneurysm or hypertension can cause it. Mm. So it raises intracranial pressure. I have explained. If you have not understood, please ask how the intracranial pressure is. I have differentiated this, and you've seen there is this area here that is the skull, the skull. This area, that is the skull here. This area is the skull. But inside the skull, there is a tough layer. This area is the skull. There is a tough layer that is covering your, there is a tough layer that is covering inside. Yes, welcome, boss one. That is covering inside here. Hmm? This layer is keeping the cerebrospinal fluid inside so that it cannot come out. See, so that it cannot come out. So we have seen how the injury occurs even in hypertension. We talked about the heart and fibrillation. So the compression of the brain brings a problem in vision because it's compressing the nerves. And then there is toxic effect of blood breakdown products. Toxic effects of blood breakdown, because when the blood is breaking down, it brings several things like bilirubin, it brings some proteins, it brings some nitric oxides, and then when they are going into the cerebrospinal fluid, causing pressure, you get a problem because in the cerebrospinal fluid, as it is circulating, it's not like the circulation of the arteries, it is another circulation. When it comes to removing that inside is a problem. Hmm? It's not like the arterial system whereby it goes to the kidney and then you filter. This one is a very different route. That's why it is very protected. The spinal cord and the fluid is very protected. So when blood gets into the spinal way, you start having problems. Because of the blood breaking down. And then we have something called transient ischemic attack. Agnes Thomas, welcome to the platform. Thanks a lot. I'm listening. I'm on the train. Thanks a lot for listening. Okay, thanks a lot. Now, there is transient ischemic attack. Transient ischemic attack. This one means it is called a mini stroke. Temporary in 24 hours. There is no place that has died in the brain. There is no place that has died in the brain. It is a warning sign of stroke. Hmm? Maybe, let's say that somewhere the blood vessels was constricted, but something happened and the thrombi got well. and the thrombi got well. So as the blood is flowing through the head, you resolve that problem. Because if the blood was here at the carotid levels that enters from the outer going to the brain, if the blood there resolves by itself, the clot moves. If the clot moves by itself, sometimes you can get a clot that is moving. Maybe it came and stopped here, stayed there for some time, caused a problem, and then it started moving. The problem that was occurring in your brain resolves by itself. So that is called transient ischemic attack. And what are the causes of transient ischemic attack? We call it mini stroke. Mini stroke that can resolve within some hours. Yeah? What are the causes of transient ischemic attack? Mini stroke that Stan's Kitchen here is here. Thanks, doctor. Welcome, welcome, welcome. Welcome for the talk. Stan's Kitchen, we thank you for being here and your support. If you have not liked, just like the talk, ask a question, any medical question that you have as we continue. Now, transient ischemic attack is a temporary interruption of blood flow to the brain. We have said atherosclerotic plague like cholesterol can cause. It can cause, because it can stay there for some time, it causes some blood flow blockage, then it resolves by itself and then it continues. That is, when it continues, it has opened the way for blood to flow. Then the oxygen will be okay. Embolism from the heart, cardiac embolism, atrial fibrillation can cause blood stasis, clot formation. Or maybe you had myocardial infarction. You remember myocardial infarction around the heart, myocardial infarction around the heart. Or maybe you had something called valvular heart disease. Can cause it. It can cause embolism. So when it is treated or when blood flows, you become well. There is something called rheumatism. We talked about rheumatism. You remember what we talked about? It can have a problem on blood flowing here on your heart. But when it kind of like resolves a bit, what happens? Your brain gets oxygen and you continue. Now, let's talk about from the large arteries like the carotid. Carotid artery plagues and emboli to the brain, the carotid that comes from the outer. And from the small vessels of your heart. Small vessels, there is something I want to tell people here. Small vessels constrict faster. Constriction brings what? Constriction brings something called flow stasis. And flow stasis in constriction is so high, but the blood is not enough. Get it? Flow stasis. So blood vessel, you understand about constriction. When they constrict the small blood vessels, what happens? Your blood is not enough that goes to your brain. You get it? So there is something called prostacyclin. These blood vessels of yours, they produce something called prostacyclin. Hmm? Prostacyclin is a vasodilator. Let me, don't know if I have paper. We write prostacyclin. Prostacyclin, when the blood vessel senses that there is a problem and you need enough oxygen in your brain, just like how it releases renin from the kidney, Your blood vessels releases something called prostacyclin. Prostacyclin, they release something called prostacyclin. Prostacyclin, which is a vasodilator. A vasodilator is what makes your vessels, welcome herbs and spice, that makes your blood vessels to relax and become bigger so that more blood can flow. Hmm? But there is something else called endothelin. This one, endothelin, is a vasoconstrictor. It's a vasoconstrictor. So in your small blood vessels, and we have nitric oxide. This one is vasodilator. Vasodilator. These ones, when your blood vessel is injured, it releases these things. So when it senses that you are bleeding, if your blood vessel senses you are losing a lot of blood faster, they release nitric oxide, endothelin. Endothelins come from the broken red blood cells and they constrict the vas vessels so that they become smaller. You don't lose a lot of blood. But when you are healed and it's okay, they release prostacyclin and nitric oxide. So when they release prostacyclin and nitric oxide, your blood vessels relaxes and then they become big and then the blood flow continues. You get it? So these are the things that are released in the cerebrospinal fluid in the brain, and then they start making you have headaches because they are not meant to be there, and they are assuming the role of healing in the veins where they are not supposed to be assuming. Now we continue about the cerebrospinal, the transient ischemic attack. Now there is major stroke and there is this transient ischemic attack. Major stroke is whereby there is paralysis that is permanent. You get it? Paralysis that is permanent. But transient ischemic attack is a short period of within 24 hours that you get a problem and then it is resolved. You get a problem like a stroke that then it is resolved. It's not like the other one. It is not like stroke. Now we have something that is very important and funny, and called funny, cerebrovenous thrombosis. Cerebrovenous thrombosis. We call it CVT. CVT, cerebrovenous thrombosis. Clot in the brain, venous sinuses. You know, your brain has some sinus. Your brain has some holes that enable expansion and relaxation. So when a clot forms there, it impairs venous drainage. It impairs how the veins are. Greetings to you, Dr. Benjamin, in the road driving. So, okay, Ako, welcome. Now it impairs how the blood is taken away from the brain to go back to the systemic circulation to be cleaned, filtered in the kidney. So there are some things that can cause this. And these things are like dehydration, sometimes pregnancy. You've had some pregnant women at times complaining of headaches because of compensatory mechanisms. Hypercoagulatable states. There are some people, their blood, their genetic makeup, they coagulate easily. The factors of coagulation are high. So your blood is a genetic condition that you just coagulate easily. Hmm? So there are some risk factors like people with when you have cerebrovenous thrombosis and you are what how can you know that you are at risk of getting cerebrovenous thrombosis? Thrombosis, cerebrovenous thrombosis, venous thrombosis, it is happens in your veins. And you know the veins take the deoxygenated blood, it takes the deoxygenated blood back to the lungs to be given oxygen. It is the drainage from somewhere. So at the brain, we have the drainage called cerebrovenous thrombosis. So there are people who are at risk, mostly that those that have hypertension. You can form any clot anytime because of heart fibrillations, heart beating so fast at times. And then we have diabetes mellitus. We have people who smoke. Smoking is coming everywhere. Eh? Check out if you are smoking. Welcome, beauty, welcome. People with high cholesterol levels in their bodies. Hmm? Your cholesterols, mostly the LDL. You know, we have several types of cholesterols. One of them is called high density lipoprotein. That one helps you. We have the other one, which is called low density lipoprotein. We have total cholesterol, and then we have something called triglyceride. So this one that is called LDL, low density lipoprotein, is not good because it is heavy and it is making your veins to clog. So people with hyperlipidemia, people with high cholesterol levels, please check yourself. Hmm? Living sedentary lifestyle without working out, walking, you are always driving, you are always doing, you get it. You can get this problem. Yes, those are people that are are at risk. And that one you can modify. You can go to the gym, you can work out, you can do things to bring these cholesterols down. But there are some places you cannot modify. What are the things that you cannot modify? If you are growing old, you see you cannot modify. If you have been at hypertensive and you are old, you cannot modify. You need to live with some drugs. Genetic, if you are genetic makeup, you have problems with hyperlipidemia, you have problems with high cholesterol levels in your blood, you have a problem. So, and gender, if you are male, you cannot change to a woman. So women sometimes have this cerebral venous problem of thrombosis. Women. That's why most of the time women get something called women women get something that is called DVT, deep venous thrombosis. It is very important when you are getting this thing to go to the doctor as a woman. When you find that you have high cholesterol levels, find a doctor, let a doctor help you to manage it. And now let's see the clinical features that come out when you have these problems, or you have a thrombi and you have problems and you're feeling a headache. What will tell you that you are heading to get a stroke, or this is a sign of getting a stroke? Hmm? Sudden weakness. Common signs are when the brain is affected. Sudden weakness on one side or both sides. You get sudden illness. Facial drooping. Facial drooping. You remember what we talked about the yesterday? If you are not yesterday night at the talk, we talked about something called cranial nerves. eh? Yesterday night we talked about the cranial nerves, and we saw why some people are born with eyes like this, eyes that are looking down. We saw why sometimes some people are like that. We saw why. So we here we are saying that the clinical features that shows us, yeah, The clinical features that shows us there is a problem with the brain. Hmm? What are the clinical features? We have started by saying one, we have said by one, sudden weakness, hemiplegia, facial droop. You know, when there is increased ICP in the brain because you are bleeding inside and the cerebrospinal fluid is being added and there is more, will increase the intracranial pressure. Let me explain about intracranial pressure again. Let me explain about intracranial pressures again. This is your brain. This is the blood vessels. You get it? It is covered by a tough material that goes round up to the spinal cord. You get this? It's covered by a tough material that goes down to the spinal cord like this. That allows no any other thing to come in. There is this what I'm drawing. There is something called blood-brain barrier. BBB. We call it BBB. And why do we call it blood-brain barrier? We call it blood-brain barrier because there is no blood that is needed inside here. Hmm? There is no blood that is needed inside here. So this what I'm drawing is called the blood-brain barrier. There are some drugs. There are some drugs when you take those drugs, they cross the blood-brain barrier. When you take them, they cross this blood-brain barrier because they dissolve in lipids. But anything that dissolves in water as a drug cannot cross this blood-brain barrier. I'm explaining about raised intracranial pressure. So the brain plus the spinal cord, they have a tough covering that is called the blood-brain barrier. So if you take a drug that can cross the blood-brain barrier and have an effect on your brain, like if you have ever got pregnant and then you were given a drug called methyl dopa because your BP was high, just know that drug went to your brain because it is dissolved in lipids, in protein. So the blood-brain barrier is a protein, a tough protein. So the drug gets in and sits, but no water. It is no water can get inside here, inside the brain. So if you take a drug that is water soluble, if you take, welcome Hilda Taylor. No, we are still in the middle going on with cerebrospinal fluid complications. So when you take a drug that is water soluble, it will not help you if you have these problems here in there. So this is what happens here. Because it is tough and covered, and inside here we have a fluid called cerebrospinal fluid that helps the brain not to, it cushions the brain so that if you hit your head, the brain will not get injured. You get it? The brain will not get injured. What happens now? What happens is this. If you hit your head or your blood pressure is so high, and you see this one carotid vessels, they come from the heart. Look at this, they come from the outer here up to high, they come from the outer and come inside here. If you have hypertension and then it ruptures one of the blood vessels, what will happen? The blood will start flowing inside the blood-brain barrier, and the pressure inside the blood-brain barrier, not the arterial or venous pressure, the blood-brain barrier will be high. And if it is high, what will happen? Now, that is when you start having, because the cranial nerves that we talked about here are being pressured inside the skull. The cranial nerves are being pressured inside the skull. If you pressure a nerve, it will not innervate well. So one of the nerve is called the facial nerve. You will have something called facial drooping because facial nerve is cranial nerve number 7 that we talked about yesterday. You see, it was very important. So you will have facial, the signs that show that you have a problem. You will have facial drooping like this because the brain is compressing the nerves. Eh? Speech difficulties. Why? Because there are some nerves that are innervating the speech that are not working correctly, like glossopharyngeal, that innervates swallowing. That is cranial nerve number 9, that innervates swallowing. You see, those will be what you will see. Yes. Now we have other signs like, wait a minute, loss of coordination, because now if your nerves, the 12 cranial nerves are being compressed. Hmm? Let's go to the cranial nerves so that we can know the signs, because now it is you are bleeding from inside the cerebrospinal fluid, and you know this is a blood-brain barrier. Blood-brain barrier is protected. So we go back to the cranial nerve so that we can see what you can get, because all the nerves are being now compressed inside. The nerves are being now compressed. We go one by one. We will have number 1, olfactory. Cranial nerve number 1 is olfactory. You will lose sense of smell because it is being compressed. It's here. Number 2, optic. You will lose vision. The nerve number 2 is being compressed. Number 3, oculomotor. Eye movement will be a problem. Eh? Trochlea, eye movement again. Trigemina, facial sensation and chewing, because you know trigemina, we said, if you remember, it has 3 branches: ophthalmic, maxillary, and mandibular. They come from somewhere here. So if it is compressed, even chewing will be a problem, vision will be a problem, abducence, eye movement, facial drooping if it is affected. And you see, you can bleed inside, you can bleed from one side and then it is compressing one side. So it depends with where the innervation is coming from or where the nerve is being compressed, because those nerves comes from frontal here going. You remember olfactory, then optic, then we saw oculomotor, and then we saw trochlea in the middle place, and then we saw trochlea trigemina coming from the here maxillary region, and then abscess from the pons down there, and then facial coming down from the pons, vestibulocochlear for hearing. It comes at the pons just down around the maxillary. You saw that? We saw that. So it depends with where the pressure is. If, let's say, you are bleeding from in front. This is called the anterior cerebral artery that is coming up to here, and it is causing blood and is bleeding, and then it is compressing your head here. You will not have sense of smell. You will not have sense of smell. Hmm? So when you have in between, it means at the circle of Willis, you see these veins are forming something here. Maybe you injured the left middle cerebral artery. What you can have is loss of speech. You will lose speech. It depends with where the nerve is causing pressure. The blood that is flowing is causing pressure. So the common signs are, I'll go through: sudden weaknesses, facial droop, the 7th cranial nerve, speech difficulties because of aphaxia. Sometimes you cannot even swallow, vision loss, optic nerve is being compressed, loss of coordination, vestibulocochlear here inside is being compressed. It depends with the vessel that has been injured. Severe headache, especially hemorrhagic stroke. Headache, it comes from mostly when you have a stroke that is brought by one of these vessels bleeding from inside. You will get severe headache because when we have said the blood when the blood vessels are injured, they produce endothelins, they prostaglandins, they produce nitric oxide. Those nitric oxide, endothelins, and other things, they go inside the cerebrospinal fluid, and then they start doing what? Producing bad effects. Hmm? So, if you just want to know someone is leading to a stroke, just write the word fast. Write the word fast. You write the word fast. So this one F with facial drooping. A, arm weakness. The arm, you feel it is weak because you cannot coordinate. The accessory nerves are compressed. Arm weakness. S, you do it speech difficulties. And then T is time to act is slow. So fast. Facial drooping, arm weaknesses, even raising your arm is a problem. Speech difficulties, speech difficulties, and T is time to act. So those are the first signs you should be working on. You see, we have talked about those things that come on, and have you? Is anyone here who has ever seen someone with a very bad headaches that come and goes, or headaches that are persistent? If you have ever come across those people, now you know. In your brain, you can have something called a tumor that is bleeding. A tumor is that is cancerous. So the tumor is bleeding and is lying around these vessels. You will have headaches, persistent headaches. You get it? If you are bleeding from intracranial, you can form something here. Let me show you. You can form something here like this that is pressuring the brain. You will have persistent headaches. And if you know that you are always having headaches, and sometimes the headaches are so high that you cannot visualize, you cannot see well, just know in front of the brain somewhere, the optic nerve is being compressed. Either there is a tumor that is growing and is compressing these blood vessels and is compressing the optic nerve, and you are losing oxygen somewhere you need, or you are losing the innervation from the nerve. So if it is headache plus vision, just know both. Something is growing that is pressuring the nerve and the blood vessel. So there is not enough oxygen that is getting there, and innervation to the optic nerve is deteriorated. You should see a neurosurgeon, do a CT scan and an MRI to check what is going on so that it can be removed or it can be suppressed. I have a friend of mine, her mouth is one-sided. She's Ugandan and she was told that it's a facial paralysis, so she will get back to normal face shape. Ah, no. Cute Jesse, you need to talk to your friend to come and see me. You see, when we have said what makes What makes a person to have facial drooping is because the cranial nerve number 7, the facial nerve, has an injury. According to cute Jessie, our last born here, cute Jessie, I call her our last born. She's a still young and energetic and a good girl. Hmm? The facial nerve number 7, if it is losing innervation, and we saw that yesterday. If you didn't check on the about yesterday's lecture, please check it. Hmm? Just a minute, I check this out. Yes, we continue. Talk to that lady, tell her that one of the nerves from the brain, nerve number 7, has a problem. And that's why, when it comes, the facial nerve, it comes up to here. It is divided into two. So it comes, and I told her to ask for a ticket to go home and remember she doesn't. For sure, I pity her. It's okay. It is divided into two. So there is something called conda tympani that comes and innervates this muscle, and the other one comes and innervates a third of 2/3 of the tongue. So it innervates. So when it has an injury, you have facial drooping like this. You'll notice it. Either, this is my assumption, your friend had meningitis, or there is something that is growing on the head. She needs something called an MRI CT scan so that it can take an early help. You just what you can help your friend with if it doesn't want. You just share this video or the video that I did yesterday night to her. Let her watch it, and then she will herself start knowing that she has to do something earlier before it becomes permanent. Alcohol intake has cerebrovascular injury sometimes, toxins, meningitis. Meningitis is because it means the bacteria has entered our cerebrospinal fluid, and as bacteria are working on the proteins of the cerebrospinal fluid, you get fever, chills, severe headaches. With this one, this one is called head knuckle rigidity. If you are having so much headaches and you have knuckle rigidity, your head cannot turn and turn like this. Hmm? You see, just know there is something wrong going on, and the ICP, the intracranial pressure. Someone asked me if everyone understood when I'm saying raised intracranial pressure. Please, if you have not understood what I'm saying, raised intracranial pressure, lift your hand. I will explain very slowly because that is what makes people die. You get it? What is knuckle rigidity? It is stiff neck. Stiff neck. You cannot do this. Hmm? Because you are irritating the meninges. When you do this, the muscles are irritating the brain. You get it? Inflamed muscles are irritating the brain. Hmm? So, another thing, those people that get meningitis, the brain itself can start having inflammation. And how do we call this type of inflammation? We call it encephalitis. Encephalitis is inflammation of the brain. And then there is another word called encephalopathy. Encephalitis and encephalopathy. These two things bring two different things. I will write them down so that someone can understand. Someone has asked what is EAT. It's EAT means East African time. East African time. Now, there is something that you should listen. There is something called encephalopathy. And there is something called encephalitis. Anytime you hear of something called itis, anytime you hear of something called itis, no, it is infection and inflammation. So, encephalopathy, detoxification. Encephalopathy, detoxification. Encephalitis, infection. So, when you get a bacteria like Neisseria and then it gets to your brain, that one you get encephalitis. Encephalitis. That is, it increases cerebrospinal fluid. If the bacteria are working on them, you get meningitis because your meninges of the brain are affected and they are undergoing inflammation because maybe a bacteria got in. How does a bacteria get in? Hmm? Causes of bacteria. Causes of bacteria. Sometimes you can do a procedure when we are getting when we, a woman is getting to do a cesarean section, and then we do cerebrospinal anesthesia. Maybe you can get uh, an infection through the needle. Then after some time, you start having the problem after the procedure has gone. Eh? You see, sometimes you can get an infection of streptococcus. And then here there are some sinus, a very clear way to the brain. You can get it through blood circulation, and then sometimes blood gets inside the cerebral spinal fluid. Lumbar puncture is that procedure that we do at your lumbar when you are doing, or when we want to know if you have an infection inside the cerebrospinal fluid. You get? Those are the protocols and procedures we follow to know. We come to the L5, lumbar 5 here down, and then we get the cartilage, we take a needle, and then we get the cerebrospinal fluid. It is taken for some investigations to the laboratory. If we find any high protein levels, we know this one, there is a problem and it is bacteria that is eating. So we put you on antibiotics continuously for like 14 days. If it is a virus, we give you antivirus. If it is a fungus, we give you antifungals, IV. Treating fungal meningitis is so hard. Some of the people don't make it. Bacteria, they make it, but fungus, it is hard. They don't make it. Yes? Now, we have talked a lot of things about transient. If you have a question about anything on what, like Jesse has asked, please ask receive. Hmm? We have talked a lot of things since we started, and now we want to go to some management, like management of ischemic stroke. You give some platelets and anticoagulants so that the what is coagulating cannot coagulate. It thins the blood so that it continues circulating. If it is hemorrhagic stroke, you have bleeding somewhere, you control the bleeding by stopping the bleeding, and then you don't give aspirins. The blood will be light and this person will bleed so much. So you don't give aspirins and as anticoagulants or clopidogrel. You don't. And then you manage the ICP. ICP is raised intracranial pressure. Hmm? We have blood pressure, the one you know. We have portal hypotension, that one we talked about. And then we have intracranial pressure. So when you hear about intracranial pressure, just know I'm talking about the pressure inside your cranium, your head skull, which is covered from the head skull, from the head to the spinal cord down there up to the lumbar. No drug can cross there unless it is a drug that can cross something called the blood-brain barrier. If it is any drug or food can cross, then it can go, but many things don't cross. Hmm? You get it? You can only use some drugs to reduce uh, the raised intracranial pressure. Which are these drugs? You can use diuretics like mannitol to relieve more fluids, or give hypertonic saline, which is alternative. Saline is sodium plus water, but those ones are measured in hospital. You can use furosemide to release more water from the body. Get it? Hmm? And sedation. You know, when you sedate someone, what happens? When you sedate someone, metabolism reduces. So the cerebrospinal fluid and the effects that are inside, this person will not continue with metabolism. But there is another way again. You can use dexamethasone. Dexamethasone is used when you have a brain tumor, but it is not used when you have a trauma. When a vessel is damaged, don't never use it. It's a steroid. But in brain tumor, sometimes it reduces the inflammation and you stop having the headaches. Hmm? Control the fever. Because if you give something like paracetamol, it stops some mediators of inflammation that are called prostaglandins. So prostaglandins are the ones which comes around where there is an injury, and then they dilate that place so that the place can have more blood flowing around that place. And when there is more blood flowing around that place, what happens? You feel good. Now the cells receive oxygen, they start healing. And you know, when more blood is coming, it is bringing more cytokines like macrophages. We talked about yesterday the white blood cells, the lymphocytes, the B lymphocytes, the T lymphocytes. The B lymphocytes, we said, they mimic pathology, but when it comes to T lymphocytes, they kill directly what is happening. They destroy the cells. Yeah? They destroy the cells that are bad. So when blood flows where there is a problem like that, it produces the prostaglandins. And when you stop the prostaglandins, you are stopping that process to go. Sometimes the raised intracranial pressure stops. You get it? Hmm? You control seizures because sometimes headaches can lead to seizures and injured brain can lead to seizure. You control the seizures. Hmm? And you do some CSF draining to reduce the pressure. That one is done in the hospital. You get it? It's very important to note these things. Hmm? So we have talked about some things that we can manage. Let's see what complication. Is there anyone who is having any question? If you're having any question, please drop it now with you. There are some complications that you can get. There are some complications that you can get in cerebrospinal injury, and these are permanent complications sometimes. So neurologically, your nerves, you can start having paralysis. That is now a stroke that has given you paralysis because you bled, there was high pressure, and then it destroys the nerves. So the nerves that are innervating speech are gone. So you will not talk. Sometimes when the accessory nerve is very, if you notice, most of the people, you'll get one hand cannot work because maybe the accessory nerve, the accessory nerve, it is called spinal accessory nerve, was damaged. When you are having it, it is damaged. It is cranial nerve number 9, spinal accessory nerve. So when you are bleeding inside your brain and then it goes to cerebrospinal, it disturbed the ninth cranial nerve. Maybe you are bleeding under here, the basilar artery where the cerebrospinal nerve is. It destroyed it. That's why you will see most of the people, depending on where they have the problem, you will see the hand maybe and this leg, this side has gone because maybe the basilar artery was bleeding and it destroyed the nerve that is coming from this side. They are always two. So one side has gone. Hmm? Aphaxia. Sometimes even swallowing becomes a problem. Talking becomes a problem because when you are bleeding, let's see, in the cranial nerves, 12 cranial nerves, eh, you injured a nerve and oxygen was not enough. Within the required 24 hours, nothing was done. So cells around that area where you were bleeding died. And what happened? Some movements of the tongue gone because the nerve arises from that brain part and it has died. You see, it is important to note this thing. So if you see that they are happening, don't panic. Take good care of this person by rushing with this person to the hospital because sometimes what we do when it is we do a CT scan and we see active bleeding, we do something called a borehole. If a borehole is done like this, you create a hole and then immediately you capture that vessel that is bleeding, eh, and then it stops to bleed. After it has stopped to bleed, you suck out all the blood that is around that area, and then you return, close the place that you drilled. You have to drill the cranium, the skull, so that you can reach the bleeding area. You see, so that you relieve the pressure. You relieve the pressure. So the most important thing that you can do, one, when you see someone is having anosmia, someone cannot interpret what is smelling and is having a headache. Someone has bad vision and is having a headache. Someone cannot talk well and is having a headache. Someone cannot drag the shoulder and is having a headache. You know, dragging the shoulders, we say it is accessory spinal muscles. You get it, innervated from the cranial nerve number 11. Take this person so fast to the hospital. Just know this person has a head injury. When you have facial drooping, when you have the problems that I've named, eh, this person, you are giving this person a sweet thing, but he's not feeling anything. A sweet thing and is not feeling anything. Hmm? Take this person to hospital so fast. You'll be saving lives, or you'll be making this person regain the normalcy. You get it? Now, We have systemic issues like aspirated pneumonia, deep venous thrombosis, and pressure ulcers. Mhm. Why are these coming? Aspirated pneumonia. Aspirated pneumonia is because now the vagus nerve, the cranial nerve number 10, is not working, and food is coming and choking you. And the bad food that has bacteria is going to the bad place where air should be exchanged from the esophagus to the trachea. And then you start having pneumonia. Deep venous thrombosis. Why? Because you have got a stroke and you are always stagnant. Blood is not flowing. Blood is not flowing. You start having sediments of cholesterol in your leg. So it creates thrombosis and then your leg starts to swell. And because you cannot move and you are in bed for so long, that is where you start having pressure ulcers. Pressure ulcers. You see, where you have lied for so long, your skin needs some oxygen. But if you lie in one side for so long, like 24 hours, you have not moved, the skin dies at that place, and then you start having a wound. That is how pressure ulcers come. So the wound continues to dig deep because someone should let lie on one side for so long. The skin needs some air, and sometimes we can get some complications that are brain related. Brain related. Your brain can swell if encephalitis goes on for so long without treatment. Cerebrospinal fluid pressure goes so high. And when you have brain edema, you cannot do anything because all the cranial nerves are having a problem. That is when you are taken to ICU, intensive care unit, given oxygen. You are assisted by breathing, tracheal assisted breathing. You are ICP, intracranial pressure is raised, and you can get a brain herniation, some problems with wound with the brain. And when it comes to long term, from ICU and the brain, some parts are destroyed, what can happen? You get disability, emotional changes because the brain cannot release serotonin, dopa. You remember those neurotransmitters well. Cytokines are not released well, loss of independence. So you start depending on people. You start depending on people. And you see, that is very wrong. If we can save you within the 24 hours, that is very wrong. So, why have I drawn this? I have drawn this thing because I want everyone to know. If you are not seeing it, let me push it like that so that you can view it. Hope everyone is seeing it now. Hope everyone is seeing that now. Look at that. There is something called left cerebral cortex. Lateral cerebral cortex. The brain is divided into two. Lateral cerebral cortex. This side, it helps in speech area. Speech. So if it is destroyed, you don't have speech. And there is something called anterior cerebral artery. This artery here that you are seeing, anterior cerebral artery, middle brain, eh? Leg area. It helps movement. Eh? When you cannot move, you know, the anterior cerebral artery has an injury. When you cannot pass urine, urine is coordinated from the frontal part of your brain. No, there is a problem. So this is where we say ACA, anterior cerebral artery, if it is damaged and it's not giving oxygen around your brain here, anterior cerebral artery. This is where we say ACA affects continence and ambulation, continence of urine passing and coordination of the legs. See, we have another artery called posterior cerebral artery, eh, which comes from occipital lobe, posterior occipital lobe here, the lobe of the brain that comes back here. Visual hallucination. If you take alcohol and you are hallucinating, that's why it's the area of the brain that is disturbed. Or if someone is hallucinating from nowhere, just know posterior cerebral artery, this one. You see at the circle of Willis, at this that is surrounding this one. This circle here, it is behind here. It is behind here. So this circle, we have posterior cerebral artery, this one, and inside we have posterior communicating artery. So when you are hallucinating, eh, visual hallucinating, when sleeping, memory impairment, you are losing your memory every time. You have seen the people that sleepwalk sometimes. Hmm? Just know this one is not getting enough oxygen to your brain, or the blood that is supplied to your brain is less. So when we go and do an MRI, we find that these vessels have constricted. These vessels have constricted and they are not passing enough blood to this part of the brain, occipital area. You get it? Occipital area. So if you have your friend that is hallucinating every time and sleepwalking, walking in the house, a friend that is sleepwalking in the house, just know when this person sleeps, posterior cerebral artery and communicating artery, they do what? They constrict. So they don't pass enough blood to your. And I've said this phenomenon here that is round, you see they are communicating, they are round. Blood supply here goes here like this. It is called the circle of Willis. Maybe the person who got that thing, he was called Willis. And then we have lacunar stroke, small vessel damages. Small vessels, these small vessels that we are seeing, plus capillaries. You get pure motor stroke. You cannot do these hands. And sometimes you lose stroke one side. Eh? And then we have brainstem stroke. Brainstem stroke is bad because it means all the cranial nerves that we talked about are done. All the cranial nerves are finished. Maybe one side is gone completely. You cannot swallow. And we saw swallowing is brought by which cranial nerve? This is glossopharyngeal. Glossopharyngeal that innervate the tongue. And you see the tongue is innervated by two nerves. Facial nerve number 7 and glossopharyngeal tongue, which is number 9. So the facial nerve number 7, when it comes, it goes and innervates the face and goes down here at something called conda tympani, divides itself and it goes innervates two-thirds of your tongue from the tip down, two-thirds. And then we have the glossopharyngeal, eh, which has taste and swallowing. It innervates one-third that is left of your tongue going down. So your tongue is innervated by two. You get it? So the hypoglossal, which is the other one, the one of the tongue, only innervates movement. You see, that is how they work. So when you have those crossed signs that I'm naming, the brainstem stroke, you start having double vision, difficulty in swallowing, one side, you get it. That is when you know your brainstem has gone. That is permanent damage. You can avoid it when you realize this person is having this issue, and then you rush this person to hospital to get a borehole, and then we see how we can help so that oxygen continuously goes in your system. So we have the hemorrhagic strokes, which is coming like with severe headaches, vomiting, rapid deterioration, focal neurologic deficit. That is the bad one. Hemorrhagic stroke, it is bleeding inside the blood-brain barrier. So the pressure here becomes so high. As your BP goes high, you are giving more blood to the, and you see that is where you start vomiting because the places that are coordinating eating and hunger, they are being compressed and you are removing everything. The vagal tone, vagus nerve number 10, is always being pressured, and if you eat something, it removes it. Yeah? If you eat something, it removes it. You see? Hmm? So hemorrhagic stroke is bad. That one needs quick emergency services. Yeah? Neurological deficit. That one you cannot even walk. You cannot even do something. And then we have subarachnoid hemorrhage, thunder headache, subarachnoid. There is a layer here called the arachnoid layer just after the brain. So when you start bleeding, it forms something like this that I've drawn, like this one, and then it pressures the brain. So when it pressures the brain, you start having severe headaches and vision problems. Photophobia. If you see light, you cannot even look because you are photophobia. It is pressuring the brain, pressuring the brain. Hmm? And most of the people who have subarachnoid bleeding between the arachnoid layer and the skull, what they usually get is they go unconscious. This one needs immediate borehole. We remove the blood and we capture the blood vessels that is bleeding. You get it? So if you feel anything, if you feel you see these signs that I've said, let me go through the signs or the causes of, first I go through the causes of ischemic plus hemorrhagic stroke. Because with ischemic, we've said is lack of oxygen, deprived oxygen. And hemorrhagic stroke is stroke from bleeding. So the cause of ischemic stroke is vessel blockage. The veins have blocked, the arteries have blocked. So oxygen is not getting there to give oxygen. Hemorrhagic is rupture. These vessels are bleeding. Hemorrhagic. These vessels are bleeding. Onset of ischemic stroke, because blockage becomes slow and slow, it is gradual or sudden, depending on how the plaques or the clots are. But hemorrhagic is very sudden. Once you start bleeding, you know you bleed and bleed and bleed. That is sudden. But in hemorrhagic stroke, you will get headaches because of losing blood. But in ischemic stroke, because it is gradual and some blood is going to the brain, you will not get headaches. Headaches come because you are not giving your brain enough oxygen. See that? Consciousness. Sometimes in ischemic stroke, because it is slow and gradual, consciousness is there. Or if it is sudden, it is mild dizziness. And ischemic in hemorrhagic stroke, you can go unconscious immediately, mostly when you are bleeding from the large arteries like the common carotid arteries. Or you are bleeding between here, the interior cerebral artery. You see, when you do a CT scan, what happens? Normally, you will see early signs in ischemia. But in hemorrhagic stroke, if you do a CT scan of this head, you will see some blood that is piled somewhere, always, because it cannot come out. You have to drill the blood-brain barrier in the cranium. You cross through the blood-brain barrier so that you can remove the blood. Hmm? When it comes to hemorrhagic stroke, treatment is always surgery and control of BP. There is no any other way. But when it comes to ischemic stroke, you can give statins and antiplatelets, and things are good. You get it? Hmm? Now, we have talked many things about ischemic stroke, and we have talked how the cranial nerves are affected. Now you can know why yesterday at night I had to come and talk about the cranial nerves. Because without knowing about the cranial nerves and its effects, we could not talk about this topic. So if you have not gone through the cranial nerves, and you have seen our friend Cute Jesse here have said one of the friends had a problem with facial drooping. Now she knows why, and she can help the friend by sharing this video and the friend getting help. Hmm? See that? I've seen there is a topic that some people are telling me to discuss, and I think I will do it at our usual time at night because it's a subsidiary. It's not under cardiovascular, but it will help when it comes to cardiovascular issues. So, as we talk, anyone has a question, please? Anyone who has a question or where you need me to paraphrase a bit? Mhm. Anyone has a question? Anyone who has a question? As you think about the questions, as you think, please, this is head injury. This is a serious topic. Please think of anything that you think you have not thought. Hmm? People are asking me to give emergency first aid on head injury. That one I can do it at night because it's a topic of around 30 minutes to 1 hour. So as I come, let me recite a document. As I come, please, I expect some questions for 10 minutes, then we call it a day. As I come, please put on those topics that we need to discuss. I answer for 10 minutes, then we call it a day. Yes, yes. No one has had any question. I think no one has have no question. No one has a question today. Let me not go without having a question. That's why. Yeah, Dorothy. You want to sort, eh? I'm waiting for any question that comes so that we solve. Doctor, what causes itchy on the foot of pure circulation? What, doctor, what causes itching on the foot of poor circulation? Itching. We call it, Hilda Taylor, we call it paraesthesia. We call it paraesthesia. That one I can only explain as I, with a drawing so that you understand well. So that you understand well. Let me help you understand it so correctly so that you cannot next time give me time. I want to explain with a drawing so that you can understand it well. Itchiness, Taylor has asked what causes. If anyone has another question, please bring it out. Anyone who has another question, please bring it out. You have said what causes itching on the foot of poor circulation. Now I draw the foot here. This is I'm drawing a foot. I'm drawing a foot here. Foot. Drawing a foot there. See, this is a foot. This is the thigh. We have the thigh bone here. And the thigh bone there. Now that is your foot. This is called the femur. This is called the tibia and fibula, the bones of your foot. But you see, we have a circulation of okay. What causes itching when taking shower? We have okay. Most one, I'll answer that. We have a circulation like this one. want you to check this circulation. This is the blood vessel. Now, when you have poor circulation, it means when you have poor circulation, it means when you have poor circulation, what does it mean? It means that part of this, just a minute, I want to show you something. You see, here down here, we have two veins that come and divide here, which is called the dorsalis pedis veins. This one is called the dorsalis pedis. And then we have the popliteal vein artery. We have the popliteal artery. This one is called the popliteal artery. The popliteal artery comes from the femoral artery. You get it? And then it is divided. You see, I've drawn here two veins, the blue and the bright, the blue and the red one. This one is called the and tibial artery and the popliteal artery. You get it? The popliteal is red and then the tibial artery is blue. So they divide here. And most of the time at the thigh, here at this area, where they divide, you get sediments. Sediments, and then sediments are where they divide like this. If you have high cholesterol, Hilda Taylor, listen to this. If you have high cholesterol, you get sediments of cholesterol here. If you get sediments of cholesterol, this one is around here, around here. Many people get even varicose veins at this area. Why? Because the division of this popliteal and not popliteal and the femoral artery, the separation here, what does it do? It makes it hard for blood to flow back, making you have fluids retained in the muscles down here. If fluid are retained in the muscles down here, what happens? These veins, they increase in size, and as you know, nerves follow the veins and arteries. Nerves follow the veins and arteries. So when they are increasing in size, they are pushing against the nerves. And if a nerve is pushed here, what happens? You will feel the effect of tingling sensation on your extremities. You get on your extremities. This is your leg. And I have explained well why people, most of them, they get varicose veins that protrude from this side. And you attest to me, if you look at someone who has a poor circulation, even in the heart, you will see these veins are protruding behind here because of this division. So when the blood is more in this circulation and there is an attack, there is no blood is flowing from the veins to go back, they press against the nerves. And when you press the nerves, you feel tingling sensation here. It is called paraesthesia. It is called paraesthesia. So if you've been feeling that, you need to do something called a Doppler's ultrasound. A Doppler's ultrasound will help you see where the veins have a problem, then it will be sorted. Now, what causes itching after shower? Or Hilda, is that explanation okay? Is that explanation okay? Hmm? Is that explanation on point? Sometimes I really need when I, 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 I explain something to someone, at least I do it well so that this person can get help or can understand the problem. Hmm? I think I've done it. Hmm? It is simple. Okay, as if the tailor is answering me, um, what causes itching after taking shower? The transition between constricted constricted cells and the afterwards from the mostly when you have taken shower with hot water, you will get that because some of your when you are pouring hot water and you have not showered for some time, your body compensates. It releases some histamines and sometimes it is some dry irritations. You get it? So when it releases some histamines and the dry irritations, what happens? You feel itchiness. Feel itchiness. It is just a compensatory mechanism from giving taking a bath to normal. You will check it out. Hmm? So you should not be taking bath with very cold water or very hot water. Do a lukewarm, hmm? Or put a moisturizer immediately after you you take shower. Now, uh, is there any other question? I've done almost 2 hours. I've done almost 2 hours. Any question? Okay, I think the day is good and we have done what we can. At least you know how to work on problems concerning the brain and some emergency issues. So if time will be there today at 10, I'll come with a topic that is pointing on first aid. I'll come with a topic that is pointing on first aid immediately after brain injury at home or somewhere in a hospital setup. So if I'll have time, that is what I'll do at 10 Kenyan time, our time. So at 10 our time, you find out if in Kenya is at 10, where you are, what time it will be. Then we it is called ABCDE: airway, breathing, circulation, disability, yeah, and 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 exposure. We will do that at 10 so that we understand when you see head injury is something that needs immediately help. So we will do that at 10 and then we know the way forward. So my people, thanks so much for logging in. And for those that have channels, please, if you are new here and you've watched, go and support the people that have the links on the chat. Bye bye. See you at 10 or tomorrow. See you at 10 or tomorrow. At 10, I'll be dealing with emergency because brain injury needs emergency uh, first aid or emergency hospital attention. So I'll do it at 10 because tomorrow we have another topic. We are continuing with cardiac issues, and circulation is part of cardiac issues, and stroke is part of it. That's why we did it. And I really need to do the emergency issues, how to help a person, because most of the time these things happen when people are at home or traveling. So I want to do how you can help a person when he's traveling or at home. So bye. Meet at that time. Everyone, have a great day and be blessed.